Okay. Well, thank you very much for joining us today. My name is Libby Davies, and I'm the Member of Parliament for Vancouver East, and I'm also the health critic for the official opposition, the NDP. We're here today to speak about Bill C-460, which is a sodium reduction bill that's going to be debated in the House of Commons tomorrow. For the first time, it will go to its first hour of debate at second reading. I'm very delighted today to be joined by the Deputy Health Critic for the NDP, Dr. Juita Sala, and also Rachel Bard, who's the CEO of the Canadian Nurses Association, and also Bill Jeffrey, who is the National Coordinator of the Centre for Science in the Public Interest. I'd also like to let the media know that Dr. Norm Campbell, who is the Chair of the Heart and Stroke Foundation, Canadian Institute for Health Research in Hypertension Prevention and Control, who's based in Calgary, unfortunately could not be here today, but he does have a press release and he is available for media comment, and he's certainly one of the key experts in Canada on this issue and has been a leading advocate for sodium reduction. I'm just going to make a few introductory comments. This bill is about better health for Canadians. It's about prevention. It's about looking at the burdens on our healthcare system and what we can do to make Canadians healthier. And certainly the issue of sodium intake in Canada, as we know, is very high. It's currently estimated that Canadians consume about 3,400 milligrams of sodium per day. What's ideal should be about half that amount, about 1,500 milligrams per day. The bill that is going to be debated tomorrow is a very straightforward bill. It's to reduce the sodium levels in the food supply by implementing the sodium reduction strategy for Canada, which was released by the Expert Sodium Working Group in 2010, but is yet to be implemented by the federal government. So this bill is based on a huge body of work that's already been done. And has been endorsed by many organizations. For example, in January of 2012, there was a letter from 17 major organizations across the country calling on the Prime Minister to move ahead with a sodium reduction plan. Unfortunately, we've seen very, very little work done by the federal government. So the bill before us will ensure that this sodium reduction strategy is put in place and is implemented. It will improve labeling of sodium on foods. It will also protect children from being deceived by advertisements for high sodium foods. And we have a very good model for how that works in Quebec. And it will also ensure that government funds are not purchasing foods that are too high in sodium. And it will establish Canada as a leader in monitoring and ensuring that progress is being made by food companies to achieve sodium reduction goals. This has actually been a big body of work by the World Health Organizations. Many countries around the world are taking very aggressive action on sodium reduction because they know it's probably one of the single most important public health measures that can be taken to improve population health. Canada is falling behind. We hope that this bill, with the wide support it has, and we have so far 30 major organizations and individuals supporting the bill, and the list is growing every day, from organizations like the Canadian Medical Association, Dietitians of Canada, Canadian Nurses Association, Canadian Pharmacists Association, Public Health Physicians of Canada, Canadian Public Health Association, the Ontario Medical Association. The list is quite huge of the number of organizations that are endorsing this bill. So we're here to urge support for this bill. There's a very active lobby going on for the bill, and we look forward to the debate tomorrow in the House of Commons. So now I'd like to call on Dr. Sala to make a few comments.
Merci, Libby. Bonjour à tous et merci d'être ici. Comme vous pouvez le voir, le projet de loi de ma collègue Libby Davis reçoit un appui fort important de la part de la communauté médicale et des experts du milieu de la santé. Ces appuis démontrent clairement la nécessité d'agir maintenant sur cet enjeu qui touche tous les Canadiens et les Canadiennes. Par année, les Canadiens consomment en moyenne le double de la quantité de sodium dont ils ont besoin. Nous savons qu'une trop grande consommation de sodium est responsable de maladies cardiovasculaires graves. En réduisant la consommation de sodium, plus de 23 000 accidents cardiaques pourraient être évités et plus de 2 millions de Canadiens verraient leur tension revenir à un niveau acceptable. La stratégie de réduction de sodium que l'on retrouve dans le projet de loi a été élaborée en 2010 par le groupe de travail sur le sodium. Elle recommandait, entre autres, une plus grande éducation et surveillance du sodium consommé quotidiennement. 77% du sodium consommé provient des aliments préemballés et c'est pourquoi il est important d'agir maintenant pour diminuer ce taux en supportant le projet de loi C460 de ma collègue Libby Davis. Merci pour votre attention.
Thank you, Joanna. And next we'll call on Rachel Bard, who's the CEO of the Canadian Nurses Association.
Good morning. Good morning. Thank you, Ms. Davis, for inviting the Canadian Nurse Association here today. On behalf of nearly 149,000 registered nurses that CNA represent, I am pleased to help you launch the sodium reduction strategy bill, a proactive measure that will directly improve the health of many Canadians. Le projet de loi C460 est un excellent exemple de politique de santé revendiquée en ferveur par l'AIC. À titre d'infirmières et infirmiers, nous comprenons la réelle portée des facteurs indépendants du système de soins de santé sur la santé d'une personne. Les Canadiens en sont aussi conscients. Une récente recherche sur l'opinion publique par l'AIC a révélé que 93% des Canadiens croient que toute politique publique doit tenir compte des effets positifs et négatifs sur la santé de la population. En réduisant et en réglementant l'apport de sodium dans les aliments que nous consommons tous les jours, notre gouvernement s'efforce de limiter les cas de pression artérielle élevée, d'accidents vasculaires cérébrales et de maladies du cœur, de graves problèmes de santé qui touchent des millions de Canadiens. Ce projet de loi favoriserait des économies de plus d'1 milliard de dollars en soins de santé, sans compter qu'il peut contribuer à prévenir les décès prématurés, prolonger le maintien en bonne santé et stimuler la productivité de l'économie canadienne. L'AIC exhorte les gouvernements à tenir compte dans leur planification de l'impact possible des politiques, des lois et des programmes publics sur la santé. Intégrer une évaluation des répercussions sur la santé dans votre processus décisionnel permettra de bâtir un Canada en meilleure santé. Je vous remercie.
Thank you very much, Rachel. And Bill Jeffries, who is the National Coordinator of the Center for Science in the Public Interest.
Thank you. The Center for Science in the Public Interest is a nonprofit health advocacy organization specializing in nutrition issues. We accept no funding from industry or government. We are fortunate to be funded by nearly 100,000 subscribers to our Nutrition Action Health Letter. I was a member of Minister Glukak's sodium working group, which came up with a strategy that is at the heart of Bill C460. Every year, about 16,000 Canadians die as a result of heart attacks, strokes, and heart failure attributable to excess sodium in the diet, about 3/4 of which is added by food companies to processed foods. CSPI strongly supports Bill C460, and we are joined in doing so by, at last count, 36 experts and health groups in Canada. The need to reduce sodium in the food supply and in the population intake has also been endorsed by the World Health Organization, the U.S. Institute of Medicine, which is used as a base. Their advice is used as a basis for a lot of Canadian policy, and a high-level declaration of the United Nations General Assembly. The The target that the sodium reduction strategy is based on, reducing current intake from 3,400 milligrams per person per day to 2,300 milligrams, was actually embraced by the Prime Minister and the provincial and territorial leaders, I think about 2 years ago. And it's just a matter of adopting a strategy that's going to get us to that end goal. The voluntary approach has not worked. That's the approach that we've essentially been using. Food companies have even failed in their efforts to report on their sodium reduction activities to the federal government, as shown last June when Health Canada's progress report relied on 3-year-old data that its own officials had painstakingly collected. Bill C-460 would ensure better accountability of companies to their customers and to the government. Without the bill, food manufacturers and restaurants will continue to hide and understate that they have unsafe levels of sodium added to their foods, and provincial governments will continue to be saddled with high Medicare costs as a result of health care and lost productivity. Thank you.
Thank you to all of you, and we're happy to take any questions. Yes.
Hi there, Ms. Davies. The numbers, the data you present definitely suggests that this is a problem for some. What would you say to Canadians who are confused why the solution is then regulation for all?
Well, I do think it's a very broad public health issue. The fact is we're all eating too much salt. It's not good for us. Some of us are at greater risk for disease, for cardiovascular disease, because of other conditions or so. But I think it's a general across the board public health issue, and we should be particularly concerned about children. Canadian children are growing up eating enormously high levels of sodium. And so, we can look at the adult population today, but we also have to look at the younger generation and what's going to happen when those kids become adults and the health issues that they're going to face as a result of high sodium intake. So it's a very broad issue. I thought very carefully about my private member's bill. What could I do that would have a very broad impact in terms of improving public health? And this is where I ended up. I decided it was the single most important thing that I could bring forward, because so much work had been done on it, but it's not been implemented. There's been a lack of leadership by the federal government, and this is something that we need to correct and to bring forward to Parliament.
That lack of leadership, what would you say is lacking on the federal government's part in terms of?
Well, they
their initiative?
haven't moved forward on the sodium reduction strategy. I mean, this was a group of experts that spent an enormous amount of time working together. They produced a plan. It hasn't been implemented. Further to that, we've had 2 reports, I believe it is now, from the provinces and the territories who have also called on the federal government to meet targets, and that hasn't happened either. So, it's rare in Canada where you get a convergence of so many jurisdictions, whether it's whether it's provincial, territorial, public health organizations, medical organizations, all coming together, saying that this has to be done. So unfortunately, it has been a lack of implementation by the federal government, and that's what this bill is directed at.
In terms of consumers also doing their part, I guess, to try and watch how much sodium they're consuming. One of the major reasons, or I guess the driving force behind labeling, was of course making sure that people knew what was actually in the products that they're consuming. Why doesn't that strategy, in your opinion, go far enough to label?
Well, I, like many people, stand in a supermarket aisle looking over a labeling, trying to figure out what's what, and understand the information. This bill will also improve labeling and make it easier